Hello all, good evening. So in this video we're going to watch neurological examination. See, in the last video I have explained what is neurological examination and what are the components are there. In that components I have explained such as how you have to do an assessment for cranial nerves and mental studies examination, how you have to check the level of consciousness, cerebral functions, right? So, and we have seen as well sensory and motor assessment for upper extremity. So today we're going to learn about sensory and motor assessment for lower extremity. Okay. So can we go for the video? Yes, we'll go for the video. Yes. See before doing an assessment, you have to do some general examinations. See, ask the patient to remove their clothes of lower extremity, and you have to do some general examinations. See, in the general examination you have to monitor whether the person is having any scar formations on their body, and you have to check the muscle wasting, which means any hypertrophy or atrophy is there or not, and you have to check the fasciculations, which means any involuntary movements of the muscles or maybe a switching of muscles is there or not, that you have to assess. And then you have to check the tremor, whether the person having any tremor or what. So these are the things you have to assess in the general examinations. Okay. So after completing all those things, you should come for a motor assessment. See, in the motor assessment you have to do a while doing a motor assessment, we can able to know that the muscle movement, muscle size, then muscle coordination as well muscle tone. Okay. So we'll see how you have to do those assessment and what are the things you should do. We'll see. Yes. See, in the motor, first you have to do a leg roll and leg lift. See, which means, what does mean by leg roll and leg lift? Means ask the patient to extend their legs and you should do some rolling. Okay. So here you are assessing the muscle size as well the muscle movements as well the coordination. Okay. So, and then ask the patient to extend their legs. Then you have to, you are the person, you are the investigator, you have to lift their legs. So here you are going to assess how much they can able to balance. Okay. So if the patient is pulled down, then they cannot able to maintain their balance, right? So here you can assess those things. See how much they can able to balance like that. Here while doing a lift, you are assessing these things. Okay. Then after completing a leg roll and leg lift, then you should come for a hip flexion, extension, abduction, adduction. See, hip, ask the patient to extend their hip and you should do a flexion, extension, abduction, adduction. See, while doing these are the things, you are the investigator. You have to see while doing an extension, you are the person. You have to give support on their back of the hand and you should push. They have to pull. Okay. So after they have done the flexion, see, while doing the flexion, you have to extend their legs. Legs. Okay. So while we are doing these are the things means you are assessing the muscle tone and you are assessing how much they can able to force, like that. They can able to force against you. How much they can, how much will be the power of the muscles here. These many things you should assess while doing a flexion, extension, abduction and adduction. Okay. Then see, after completing hip, then you should come for a knee. See, knee flexion, extension, abduction and adduction. See, after completing knee, then you should come for ankle. Ankle, here ankle, we are doing we will say that flexion extension is called as a dorsiflexion and dorsiflexion and plantar flexion. Okay. See, plantar flexion means ask the patient to extend their foot, and if they are doing downward, which means the foot, if they are doing downward, this is called as a plantar flexion, and if they are doing upward, this is called as a dorsiflexion. Okay. So while doing a plantar flexion, you are the person, you have to push your hands, you have to place your hands and you should push. They have to pull. Okay, so here you are going to assess the muscle tone of the foot, and then after completing plantar flexion, they are doing a dorsiflexion. While doing a dorsiflexion, you have to place your hands back of the yes, see in front of the foot, and see while they are doing these things, which means upward, and you are the person, you have to push against them. Okay, so after completing hip, then you should come for a knee. After completing knee, then you have to come for an ankle. See, in the ankle, you have to do a plantar flexion and dorsiflexion. Plantar flexion means, see, this part is a plantar flexion in our foot. Then this part is called as a dorsi, which means we are doing, if they are doing going forward. Which means the hand, it should be this part. If they are doing, their leg is like this, then it's called as a dorsiflexion. If moving downward, this is called as a plantar flexion. Okay, so you have to, while doing a dorsiflexion, plantar flexion, here you are the person, you have to place your hands here as well here. So you should push against them and they have to pull against you. Okay, so here you are assessing the muscle tone as well. You have to check the inversion and eversion. See, this is called as inversion and this is called as eversion. See, while doing their inversion, you are the person, you have to place your hands on their foot, and while they are doing inversion, you have to push against them, and then while doing their eversion, you have to push against like this. Okay, so this is the way you have to do an ankle dorsiflexion, plantar flexion, inversion, eversion. So after completing these things, you may get to know how much they are muscle tone. If they can able to give a full force, then you can give the muscle tone as 5. Otherwise, if the person is having a hemiplegia or hemiparesis, accordingly you should decrease the muscle tone. Clear? Yes. See, why we are doing these are the things, because in our leg there are so many spinal nerves which is connecting with our lower extremity, especially lumbar L1 to L5, then sacrum region as well, S1 and S2, which is these spinal nerves are connecting with our lower extremity. That's why if the person is having any abnormalities on their spinal, especially lumbar and sacrum region, the person will get a paralysis. Okay, so once you completed one side of the leg, again you have to repeat your procedure for other side of the leg. Okay, so this is called as a motor assessment. See, in the motor assessment, only you are assessing the muscle movements, muscle size, muscle coordination and muscle tone. See, muscle tone is 5 is normal. See, 1 to 5 the person may have. If they can able to they can able to give a full force, then you can give as 5. But if the person is having a hemiplegia or hemiparesis, they cannot able to do anything, then you can give 1. Okay, if they are giving the movements, then you can give 2. So according to the patient condition, you have to increase or decrease the muscle tone. Clear? Yes. Then see, after completing motor assessment, then you should come for a sensory. See, in sensory, in the upper extremity, I have clearly explained what is soft touch and pinprick, then vibration, right? See, the same thing only you are going to assess here for lower extremity. So first test is called as a soft touch. See, soft touch means you have to take one cotton ball and make it sharp. Then you have to ask the patient to feel the sensation first. So you have to touch on their skin, how it will be. See, this is the way I am going to touch your lower extremity. So whenever I am touching, you have to tell me. So if you didn't feel, that you should remind. Like that you have to explain the procedure to the patient. After that, ask the patient to close their eyes. Then you have to touch with a cotton ball of their lower extremity, which means a hip as well, knee, and then ankle, and then foot. You have to completely touch to the legs. Okay, so to their lower extremity. If they feel, then it won't be any problem. Okay. Then after completing one leg, then you should go for other leg. See, after completing a soft touch with a cotton ball, then you should go for a pin prick. See, pin prick means here you have to take one lancet or needle. So with the help of lancet and needle, you have to do a prick. Clear? See, first, before touching of the lower extremity, you ask the patient to feel the sensation, pin prick sensation. You can touch wherever in the body and ask the patient to get feel of the pin prick sensation. After that, you should explain. Now I am going to touch of your lower extremity, so you have to feel. If you didn't feel, then you should remind me. Like that, you should explain. After explaining the procedure, then you should go for, you have to touch everywhere in the lower extremity like hip, knee and ankle as well foot. Okay. So after completing these are the things, then you should come for a vibration. See, vibration, take one tuning fork, make it vibrate. After that, see, first you have to ask the patient to feel the vibration. You can touch maybe the in the center part of the chest or maybe in the hand. You have to place the tuning fork. After getting a vibration, you have to place the tuning fork. Make the patient to get feel of the vibration, how it will be. Like that, you ask the patient to make it feel. After completing that, ask the patient to close their eyes. Then you have to place the tuning fork on their paroxysmal area of the foot. See, which one is the paroxysmal means? See, this think that this may be a thumb finger. You have to place the tuning fork on their thumb finger. See, in the on the toe, in the toe, outer part of the toe, which means below the nail, you have to place your tuning fork on their toe and make it feel that vibration. So if they feel very well, then you should not go for a distal one. Clear? See, if they feel very well about the paroxysmal, then no need to go for a distal. If they won't feel, then you have to go for a distal, which means, see, first you should place on their which means outer part of the toe. This part is called as a paroxysmal. If they won't feel, then you should go for a distal. See, this part, the inner part of the toe is called as a distal. Outer part of the toe is called as a paroxysmal. Clear? So first you have to go with the paroxysmal. If they won't feel, then you should go with the distal part. Clear? So this is the way you have to do an assessment for sensory. See, first you have to do some general examination. Here you are going to assess the scar formation, wasting of muscles, and then tremor, then fasciculation. So after completing these other things, you should come for a motor. See, in the motor you have to do a leg rolling, leg lifting, then hip flexion, extension, abduction, adduction. Then come for a knee. After completing knee, you have to go for ankle. In the ankle, you should do a dorsiflexion, plantar flexion, and then inversion and eversion. See, after completing those things, then you should come for a sensory. In the sensory, you have to do a soft touch, pin prick. After that, at last, you have to do a vibration. So that's all about motor and sensory assessment for lower extremity. Okay. So in the next video, we'll soon in the part the topic is maybe cerebral functions of the neurological examinations, and one more topic is remaining, that is reflexes. So after completing all those things, then we'll go for a neurological disorders. Okay. So guys, I hope you all are following me, and if you need any further clarifications, or maybe if you need any specific topics videos, kindly let me know. Okay, you can comment your questions in the chat box, so definitely I'll give reply. If you need in live classes also, so kindly let me know, we'll conduct. Okay, so see you soon. Okay, see you all, bye bye.